I've been living here for the past 3.5 years. I come from New York. Okay? We've got everything in New York, all specialists. We don't have to keep coming from Pahrump to Las Vegas. I mean, we've got everybody and anybody. Anybody that we have here, okay? Now, I don't want to single out just one doctor, but I can't speak about everybody, but I will. You have Michelle Stacy, excellent diagnostician. Excellent.
And who is you?
Excuse me, that's what we would like to know, is who is you?
Who is you?
The Senior Dimensions has so far been working. I've not had a complaint. I mean, everything has worked very
provider, so that they can, have continuity of care. The thing that struck me most is that this letter arrived on April 1st after the very last closing time for Medicare enrollment of March 15th. Now, that was the part that struck me, because under
years now. My main question, which you cannot answer, is why is Senior Dimensions not out here explaining to us why they closed this down? Hours to get in and see a doctor? I mean, look at all these people. And these, I mean, how are we going to get in to see them with 3 doctors? Until this is settled. I'm sorry. And I don't know where to do or what to go until I get this settled. I am not happy with Senior
Medical care is here, and we wanted to be able to do a face-to-face to hear how you're thinking, and then offer HPN,
right, so they were dropped also.
Fremont?
Is that what you're saying?
Fremont?
Yes.
Both of
The last ones to know. Medicare, and if Medicare can stop this, or we can get somewhere with Medicare, we've got to do it. Thank you.
I'm a long-time patient of Dr. Batty's, and when I received the letter, I was kind of in shock because I was like, well, my doctor's not on here. And it states on there that if I don't choose one, which I need to choose soon so there's no interruption in my...
With him. We do not wish to change doctors. Our loyalty is going to be to the doctor and not to the insurance company, and I think everyone in the room will be confronted with that decision of changing insurance companies rather than changing your doctor. I'm not sure I agree with your doctor, which we are not. The thing that it seems to be is a business decision on the part of Senior Dimensions to try to drive the costs down, and there is no way that the doctors that are on the Senior Dimensions list can handle all of us when the move is made. The other thing is it's very inconvenient, because the enrollment period for a new insurance carrier is October 15th, but the service stops September 30th, which leaves a 2-week gap, and I think that needs to be addressed, and I hope we hear something about that this evening.
Okay. I see a gentleman behind you.
Yes, my name is Don Staghouse. I just want to know, are you going to force us to change?
No.
And how much is it going to cost us to say no?
Okay.
And also phoned me like a week later, telling me that I had to make a decision.
This lady just said that she got another letter that said that you had to make a decision about a week later. And people are also saying they're getting phone calls. Okay? Yes?
Carol Wilson again. That same thing happened to me. First, at that time, I notified them that my loyalties were with my primary care and not to any insurance company, and that I had changed insurance companies before and not have to be left out in the wind waiting for the next enrollment period, because like I said, all those changes.
My question is, who dropped who?
First, we were not aware of Senior Dimension terminating. We were not aware. Is that loud enough? Okay. I can speak for myself and all the doctors of Specialty Medical Center that we were not aware at all of any impending terminations. And I think Dr. Batty will speak for his group as well. Now, at the same time, the termination was done at no cause, meaning there was no specific reason given to us and to about 80 doctors in Vegas. It isn't just here. There's about 36,000 patients affected by this, and may involve about, give and take, about 100 patients. So they call it as a business decision. So whatever reason is, usually is a dollar or a number on it. They made that decision to say, you guys can't see us. They didn't give us a reason. They said a no cause. So I'm going to go back to another thing was mentioned, who's at fault here. First, healthcare partner has nothing to do with that. They are as victims as you are, and as we are as providers. All what they did is, they are, meaning healthcare partners. Okay, all what they did, their mistake is, if it is a mistake, is by expanding, by giving the patients options, by investing in smaller towns and also in big towns like Vegas. They are now the #1 investor, in, if we say, in Pahrump. They have the largest operation right here. They have in Overton, I think every clinic is healthcare partner, and the periphery as well. And they have about 70 doctors in their network in Vegas. So their mistake is they came into us and says, we know what you did, but we could do more. And that's how I was convinced that if we join together, they do the business part and their resources, and we practice as physicians. Because I can speak for myself. There was a time when I was practicing more business than I'm practicing as a physician. I don't like that. I didn't go to medical school to practice business. So it came a time I said, I don't want to do that. Okay? Senior Dimension chose, that was their decision, they didn't want to compete because healthcare partners accepts everybody. I mean, almost every insurance. Every insurance I used to take in my office, not a single one was dropped by healthcare partners on their end. Not a single one. So they are to include everybody. You know, Aetna, Blue Cross, and many other, I can't list you 900 insurance, not one single one we were told, now we're on board and we're going to exclude this number of patients. That never happened. But then Senior Dimension made their decisions, and I think, I don't know, that probably is what it is. Okay, they don't want to compete. They don't want to give the patients the options that you can choose this or that. We have no other reason to know. Now, I'm going to go back one thing about the open enrollment. We don't like the timing of this. They know it isn't just, you know, flip a date and then happen April 1st. This is a calculated decision, I think, unless they can say something else. There was no cause to terminate. It isn't like there were somebody being hurt or injured and they have to rush a decision. There was no cause for that. But then they did it this time, okay, to limit the options. Now, we heard stories, and you can confirm that. We don't want to be like hearsay or somebody said something. We heard a patient being told that you have to change right away because your referral wouldn't go through. Or if you're going for surgery, your surgery may not go through. Again, we heard of that. But some of you, if they did hear that, they can come in here and confirm that. Okay? Now, nobody should, my advice, panic and go anywhere until you have until September 30th. Now, some patient on special need or for certain conditions can right now, or do have right now, some options. And I'm going to go to the list. It's not long and easy to understand. If you have diabetes, this lock period does not apply to you. Then you can choice right now. If you are diagnosed with diabetes, your choice is now. So the choice was taken away from you during the summer. You have it, so some people have a parachute. I compare this like you're mid-flight and they tell you, if you don't like the flight, to jump, but you're in mid-air, you can't do it. They couldn't wait when we're still on the ground. This done. No, we're still alive. See any dimension in the room? I don't know. So some people though have parachute. You're mid-air, but you have parachute. If you have diabetes, you can't jump with your parachute. If you have any vascular disease, stroke, blockage in your carotid arteries, heart conditions, or peripheral vascular disease, you can parachute. If you have, I'm sorry.
When you say parachute, what are you talking about?
Meaning you have a choice. Because some people in this room don't have a choice at this time. If they choose to stay with us as doctors, they don't have that choice. They don't have the choice to change their insurance if they don't wish to change their doctor.
The question I have is, why did Senior Dimensions come up here for open enrollment? My wife and I are just now turning 65. They signed us up. They knew what was coming about. Why did they go do something like that, and can we get out of it?
I can't answer for them, okay? We would love one day Senior Dimension come right here and answer these questions to all of us, me included, okay? Now, I was saying about the parachutes, well, let me add, if you have emphysema or COPD, you also have the right now, even if you're locked up in this time, you can change. So, if you have lung conditions, if you have diabetes, if you have any vascular disease, you can change right now. Everybody else can wait until the 30th of September. Now, if you're under treatment, meaning if you have back problems that's being taken care of, if you have a blood pressure that's being under treatment, if you have other current active condition, you can stay until the end of January 31st of next year. And hopefully that will give you a choice. Okay?
So I would imagine a lot of this might be confusing, but to simplify, the bottom line is, and correct me if I'm wrong, no one has to do anything at all as far as switching doctors or your insurance until September 30th. That doesn't apply. And then if you fall into those categories that we described, still you would be covered by Senior Dimensions at the healthcare partner facilities until the end of January. There is no official statement right now from healthcare partners other than you have choices. We know that everybody is not on the internet, but we have a special website that lists all the other providers that these doctors in Toronto do accept. If you're thinking you want to change your insurance right now or before September 30th for that continuity of care. In the meantime, Healthcare Partners is doing everything it can behind the scenes to advocate for patients, to try to reverse this situation is what I would say, okay? And that's why we're here. But we want to hear really what is happening, how people are feeling, how you're feeling about your care right now through the Healthcare Partner affiliates, and also, instead of hearing hearsay, are you, with these letters and the phone calls, really what is going on, okay? Sir, do you have a question? Or a comment?
Yes. My name is Scott Colshaw. I'm not signed up with them. My concern isn't about HPN. I'm not signed up with them. My company dropped HPN suddenly last month. No explanation. They went with Aetna. My concern is Healthcare Partners going to see the same thing happen with Aetna insurance as HPN and Senior Dimensions? Nobody's been able to explain why suddenly two major insurance companies dropped the major providers in this area. I have used services at both these clinics, outstanding clinics. I'm not going to change. I was told by Aetna rep that they have a wider range of healthcare service providers, which makes it easier for me to choose. Again, both these facilities represented up here I use. And what advantage is Healthcare Partners presenting to the patients? I haven't heard anything that references that. I've heard privately that Healthcare Partners benefits the clinics, the doctors. What is it going to do for me?
Yeah, and Dr. Beatty, do you have a comment with regard to what's the value to these patients staying with Healthcare Partners?
Hi guys, can you hear me? I think before we answer that question, I would like to ask a question from the audience here. Is anybody still confused between the names of Healthcare Partners, Help Out of Nevada, Sierra Health and Life, and Senior Dimensions? Yes. Let's respond to that and makes it more clear of what we're talking about. Healthcare Partners is a company that is completely different than Senior Dimensions, Health Out of Nevada, and Sierra Health and Life. Healthcare Partners is a company that contracts with all of those and other ones like Humana, Aetna, Cigna, all the other ones. Sierra Health and Life, Health Out of Nevada, and Senior Dimensions are essentially under the same umbrella. Senior Dimensions is a senior portion of Health Plan of Nevada, or Sierra Health and Life, which is a PPO of the Health Plan of Nevada. But they're all under one umbrella. Healthcare Partners has been doing joint ventures with physicians in Nevada, California, and Florida as a conglomerate, and joining these multiple groups of doctors to be able to reduce duplication of efforts, and therefore have doctors like us reducing our time on paperwork and having more time with our patients. So to answer the question that was posed earlier, how does this benefit the patients? I personally believe that I myself and most of our providers have better direct guidelines. We have access to more specialists. We have business people running the business portion of this, our companies, and making us more effective as physicians to manage our patients. There is a group of specialists that the Healthcare Partners have been working on to bring out more than what we've already had. And one of the biggest and most important things that I've come across is the ability of electronic medical records. Our group is on electronic medical records, and we no longer have to go look for charts all over the building looking for patients' information. And this will be all centralized. It'll have more access to the nursing staff, to the providers, to the specialists, and all these things take time and take steps to get to where they are, where they need to be. What has happened now is, so everybody understands, we as a group of doctors, nor Healthcare Partners, did not change our contract or request any changes in our contract. The contract was dropped. I came to work on Monday morning, and a patient of mine brought a letter to me. She's asking me why did I drop her. And I didn't know what was going on. That was the first time I heard about this. So we didn't know what's happening. I do believe that this is an insurance company making decisions on behalf of the patients. From what I understand, there have been phone calls to the patients. And I personally value my relationships with my patients. I've told my patients I don't care about Senior Dimensions, nor Healthcare Partners, nor anybody else. I have an obligation to my patients. And if it means that they fall in between the time that they have insurance with one carrier and they want to switch to another carrier, whatever it takes, I will see my patients for free until this is resolved. I just want everybody to know that this September 30th deadline does not mean that you have to change immediately now. You have till September 30th to choose. This whole mess might resolve between these big insurance companies, A. B, a lot of the patients that have active problems, if you have back pain, you have high blood pressure, diabetes, whatever, you're treating with your physician for an ongoing problem. You have another 120 days extension, which brings you into the enrollment period that you're talking about. And if you choose at that point to change into another carrier, you're more than welcome to do that. Also, like Dr. Tenori was talking about, there's a special needs program. Any diagnoses, there's 5 diagnoses that he went over. If you have any of these diagnoses and you just want to switch over to another carrier right now, you're able to do that as well. So there's a lot of options here. My personal main concern is patients getting upset. I had a 93-year-old patient of mine come to my office crying, and her blood pressure is through the roof, thinking that she's got to change her provider, and she's absolutely hysterical. So my request of all you guys, my patients, everybody is, don't panic. Things will work themselves out. We'll know what's the right thing to do, and just don't make any hasty decisions on your health care.
Question. A comment, sir?
I have a statement. My name is John Zakis. My wife and I are both patients of Dr. Stacy and have been for many years. To do with an organization that would use us as a bargaining chip, if that be the case. Now, as you can see, I have COPD and I'm on oxygen. It's been helpful to change me over right now. I'm now, as of May 1st, I will be a Humana customer rather than senior mentioned. And I would say, in my opinion, Humana gives excellent service, both from online and on their phone conversations to the main office and from our local representative here. I know you people can't say the same thing, but I sure can. Thank you all.
The dimensions first to complain, and then in a few days they called us back to make the transition easier, which I told them I wasn't transitioning. I was waiting until the 11th hour. And it's my understanding, and I could be wrong, that the contracts are with the doctors and not the organization.
It's with the organization.
It's with the organization, not the doctors? Okay.
Yes.
We're going to negotiate something, because I can't understand why we can't coexist with one provider providing for everybody in this room, other than just senior dimensions and so forth. I don't know if they're still going on or not, but my thing is that who are you playing with? You're playing with our lives and our providers who we're happy with. That's.
I know that a lot of people are probably not on the internet, so we're going to be doing a follow-up letter. This is from Healthcare Partners with a list of the providers that
in town from Happy Pediatrics. They probably don't. They probably don't. I mean, they have to answer these questions. Now, I'm going to go back on one thing Dr. Batty has mentioned about treating our patients for free. We offered also, and we requested from Healthcare Partners, because the owners now of my clinic and Dr. Batty's clinic is Healthcare Partners. We offered, we put on the table, our doctors also in that transition period, that if we could do it for free until, but I'm not going to say it until we get a final decision from Healthcare Partners. So I wish that we didn't bring it up, but it just happened that way. Okay?
The second part to that is, will we be able to leave our health insurance plan after September if they're not going to cover anybody here in town?
you're talking about HPN?
Yes.
Those are questions, and I hate kicking it back, but those are questions for HPN.
Okay. Thank
you. Yes?
I'm also with HPN, and my husband's employer offers the PPO.
You're a good tech guy. Thank you.
I think everyone is kind of missing a point here. I have a real strong suspicion why they're doing this. You do know they're building a Southwest Medical Care facility here. HPN wants you to go to Southwest Medical, to their filthy, disgusting, substandard care facilities. I have been forced on more than one occasion to go to their facilities in Vegas for testing. I have gone in, I have written letters of complaints, I've turned them into the Clark County Health Department. They don't keep an eye on files, they leave needles laying around. Totally unsafe facilities. I refuse to go. I now have a letter from HPN that says I don't have to go there anymore for my CT scans because I'm that fed up with them. But they're bringing a facility here. They want all of you to go to Southwest Medical.
You know, let me answer that. We're happy if they're going to open SMA right here. The more, the better. We don't have an issue with that. But why excluding and eliminating the options?
Right, because
they can have HPN
if they eliminate you though, and they bring in Southwest, then we're all forced, whether it's Senior Dimensions or HPN, we're all forced to go to that facility for every sneeze, sniffle, and high blood pressure.
Well, it goes back to the word choice. Now it goes back to the word choice. I don't think anybody had the gun in their head when they signed with an insurance plan. I've heard it time and time again from my patients that they ask the question because many of my patients were with me before they signed on either HPN or Senior Dimension. And the question comes, or the information comes from my patients. I asked, okay, can I keep, if I sign on this plan, can I keep my doctor? Sure, you can keep your doctor. Apparently not. Okay, so, but there's back to the choice. Now, we are locked into this situation. We're not panicking. Okay, we want them to rethink their decision. We will work with them. We're not terminating them. We're not going there. Okay, let the good product sell itself. At the end of the day, collectively, the collective wisdom in this room and in this town will figure out, okay, who's doing right for you and who's not. Who's trying to take an advantage of a locked up period that, quote, coincidentally coincided with the closed enrollment period, and who's not. We would like to compete with HPN. That's good, good for the town. Bring the best of each one of us. But to force all of you to go into a limited option, it's going to take, I feel sorry for the receiving doctors. You are going to be competing for them? I feel sorry for them. Because I know when I receive new patients, you have to take more time, you have to learn about the patients, okay? And you guys sometimes are tricky, okay? You introduce a lot, okay? These guys are going to be really whipped because the manpower we have right now, at least 2 to 1, if not 3 to 1. So knowing that Pahrump maybe is still underserved, and we can argue about whether there's enough doctors in this town or not, but the other doctors already are busy. And then you're going to get all of you, and this is the tip of the iceberg. Plus, they probably don't know anything about you. And we know when we have new patients, we schedule 2 times the time for a follow-up for another patient, because it gives us more time, you know, to understand and help us to understand your medical conditions. So these guys, they're going to be outnumbered. I mean, 3, 4 hours, we said earlier, somebody made the comment, could be 3, 4 days. Okay, you might get a camping, you know, in there. Our concern is somebody may get hurt in this transition period, okay? And I do see, I mean, seriously and sincerely feel sorry for the other doctors that they're gonna get a flood of the patients hurt into there, know nothing about, and they're gonna be like, who's who? We don't want that. All we ask at HPN, Senior Dimension, okay, let us care for our patients. If you could let it open till, like, you know, make your decision, postpone it until the open enrollment, and give the patient the choice. You told them they can keep their doctor. Keep that choice or that promise.
But right now, you're not seeing a problem with the PPO.
No, we're not seeing a problem with the PPO. Someone else has a question or a comment?
Yes. Is there a healthcare partners representative here?
You're talking about admin, administration?
No, administration.
No,
yeah.
not today. We wanted to have the doctors here with the patients.
Okay. Well, I'm Dr. Mehdi. I am a medical oncologist, and I opened Param's first cancer center just over a month ago. And this was motivated by none other than one of my patients, my very first patient at my Las Vegas practice, who happened to be a Param resident. And she unfortunately is no longer with us, but we're proud to have her cancer center named after her. And that's the main motivation. Coming to the point, I requested both healthcare partners, and I guess that question is more relevant, that the patients that are traveling to Las Vegas for their chemotherapy, that they be allowed to get their treatments here. And I got a letter back that currently there's not a need. So I have a copy of the letter with me.
Doctor, I appreciate you coming right now for this one. I know you want to advertise your services. We as providers...
It's not about me, it's about the patients. I do not care if I am allowed, if they can bring a in-network physician to come and serve the people, I would be satisfied. If not, then I think the people deserve the chance to be treated closer to home, and that is the whole point. And I think we missed the point, absolutely. And I don't care if I get the patients. Another facility can come and treat them as long as the patients are taken care of. I'm happy with that. And so are my patients.
First doctor, welcome to Param.
Thank you.
I hope you're gonna live in this town. Are you commuting or you live?
I am currently commuting.
Okay, we would like you to buy a house and stay here.
Absolutely. My services are available.
And I'm gonna hold you to that. I've been in this town for 13 years. Okay? Dr. Perry, how long have you been in town? Okay, 16 years. Now, what is unfair, okay, and that's why I came in here. This is not a business, okay? If you requested from a corporation about a contract to do it, it's not at this current time because you could see what is going in their mind right now. You are not on the radar, but the patients are.
Right. The reason that I wanted to say is that I really don't care if I get the contract, so as the patients know that when they walk into my door, I have been and will continue to see. I have been seeing patients for free, and I will continue to do that. But I am prohibited because of the cost of chemotherapy. I cannot buy it for them, so that the patients know that I have made a fair attempt, and it's not me that is not wanting to take care of.
No problem. We do have in our clinic, especially Dr. Parikh, okay, who's an oncologist. He's been coming to our clinic for a bunch of years. And him and I tried a long time to get the chemotherapy going right here.
We actually have it going for the last month. There is actually infusion going on at Hope Cancer Care of Nevada every Monday. We have patients who are getting treatment.
So may I have your business card? Because
I think the more important part would be to have the patients have that choice. I really do not care if I am allowed to take care of them. The point is not about coming and seeing patients and taking them to Las Vegas to increase the business. The point is bringing the care closer to the patient so that they don't have to travel an hour and a half each way while receiving their chemotherapy, taking their nausea medicine, and taking their chemotherapy bowls with them. So I think that's just unfair to me.
And that is a point that is well taken about traveling. And again, I'm not a representative of healthcare partners, but I've heard discussions about coordinated care and more specialties here in Pahrump to reduce that.
So I just hope we can all work together.
Yeah, absolutely. And that's why when you think about it, actually, that we're here and we have your doctors here, because we want to keep the patients with their doctors and those relationships, and then grow the services that you can receive in your own community.
And I will continue to see the patients that I have for free. I cannot administer chemotherapy just because of the limitations, but until there is an in-network provider through healthcare partners that comes and takes care of them, I'll be happy to see them for free and coordinate their care.
Now we have 3 more people, but I want to say a couple of things before people leave. people leaving. You're going to see a campaign and then another person here too. You have choices. We're trying to simplify it. Again, not a battle over patients, but making sure that people here know that you don't need to do anything right now. And then also, we want to thank the folks that have called Medicare, that have called the Nevada State Insurance Commissioner, and others, because your voices are being heard. And what we would like for you to do, this is the patient advocacy piece of it, is speak up. Speak up. And that will help, work out these situations. Another thing, though, is we're going to make sure that we communicate with you folks so that you know what is happening, that you don't read it in the newspaper before you hear it from healthcare partners. And this conversation we're having, though, is helping inform healthcare partners of what is really happening and how people are feeling and how they feel about the care that they're receiving here in Pahrump. This gentleman over here has been standing for a while. Do you have a microphone over there?
Well, let's see.
It's working. We can hear you.
I gave it a red light on and off.
Don't worry about the light. We can hear you.
Okay, in answer to the doctor's question, I don't know about other insurance companies, but my insurance company, if your doctor has an office in Vegas and an office in Pahrump, even if the Pahrump office isn't listed, they will still cover the service if it's provided in Pahrump, provided that healthcare provider is listed as a healthcare provider in Vegas. So that may be an answer for the doctors. If he has patients that are seeing him in Vegas, maybe he can check with their insurance carriers to see if they'll cover the treatment up in Pahrump rather than driving to Vegas.
Okay. Thank you. Ma'am?
Yeah, my name is Donna Goldstein, and I have HPN provided for me through my employer. Okay, both my husband and I are type 2 diabetics. So are we covered under this as well as the senior dimensions, that I don't have to make any choices till January, correct? Am I understanding you correctly? Or does this only apply to senior dimension patients?
This is an active condition, so yes, you can stay until January 31st.
And then I have some information for you. We have both offered it at my work. I can take HPN or I can take the PPO, okay, Sierra, whatever. Okay, the HPN went from $16 a month to $50 a month this year at my employer. And my employer does, it's Check City, and they pay a lot of the piece of it. But if you chose the PPO, you're paying $400 a month for the option of taking a different doctor. Okay, so this is how I look at it. Last year it was $10 to see my doctor, this year it's $15. You know what? I can go to Healthcare Partners now and my doctor will see me for $50. So what the hell's with the insurance? I mean, I can go out of network on my HMO and they're only going to cover 50% of everything, yada, yada, yada. Okay, but it's like I can go see them now. We have a separate drug program like Medicare does, okay, under HPN. We have, so it's like, okay, anybody can write me a script, it don't matter. You know, but so technically I don't have to make any decisions until we have open enrollment at my employer in November.
That would be correct.
Okay, thank you very much.
You're welcome.
So 2 more comments, and then we're starting to see people leave. So I want you to be thinking about what haven't you heard that you'd like to hear about before we leave tonight. Okay?
Thank you. My name's Butch Boraski, and I'm here speaking only on my own behalf and the seniors in this room that agree with me. That, number one, it took me 9 to 10 years to find a doctor I'm happy with. I will not switch for any reason. Number 2, I'd like to send a message to the insurance companies. In Pahrump, there's 4 things you don't do. You don't mess with our dogs, you don't mess with our guns, you don't mess with our water, and especially, you do not mess with our doctors. Thank you.
pharmacies. I've never heard of them before Dr. Stacy joined.
So her question is, who is Healthcare Partners?
That's exactly right. And the first time I heard of them was when Dr. Stacy went with them and moved from 160 over to Advanced Medical. I never heard of them before. I guess there's a lot of people in here that haven't either. But I'm just curious, where are they from? Where did they originate from?
Okay. Dr. Beatty?
Healthcare Partners is a $4 billion company that started in California. They also have services in Florida and Nevada. They are more like an IPA type of a service, which means that they get doctors to work with them as a joint venture, and the group of doctors are now represented instead of being single physician groups or two physician groups, as a group of doctors that are able to provide care under more standard subdivisions as far as their specialties and what requirements they have to follow.
How long have they been around?
Oh, that's a good question. I think they've been around
About 20 years.
I think it's over 2 decades. I'm not exactly sure.
Originated from California?
Yes.
That was my question.
That's your answer.
I've never heard about them before, and I lived in Vegas for 20 years, never heard about them.
Yes.
And you know what? That is an opportunity. People know Healthcare Partners by the former clinic names, Fremont, right? Or Summit, or Advanced Medical, you know, but now they're all part of the Healthcare Partners family. So you're going to be seeing, you know, that logo, you know, a lot more as we transition into the one big piece, but we're still using, you know, the names that people are comfortable with. Does that make sense? Okay.
Let me add one thing.
Yes.
For the healthcare partners, they have 30 years of experience. They are like franchise, okay? They have multiple locations, there's a group, it's a group practice. In Nevada, I think they have about 36 different clinics in Nevada. And I don't know the number of employees, maybe about 1,000 or 1,500 here in Nevada. And they go about for 30 years.
So 2 more questions, and then Janine, could you come up here for a minute? I want to ask you a question. We have some resources for you guys. In addition to asking you to make calls, you know, to complain or voice your opinion, we have a helpline. And I want to hear about that and ask people to call. And also a website. And on that website, if people are on the internet, you look up Keep My Doctor NV, and then you click through there, and it has your answers there. Questions and answers, and also a list of providers and insurance companies. This is Janine. She's a marketing director, the marketing director at Healthcare Partners, and we have a helpline. I hate to put you on the spot, but could you tell people about that briefly, and then you can ask your questions.
Hi, everyone. The Healthcare Partners. The Healthcare Partners helpline is dedicated to all of you. The Healthcare Partners helpline is dedicated to all of you to answer any questions that you may have. The lines open at 8 in the morning until 5 in the afternoon. We have 2 dedicated people. The number is 702-932-8585. And they will answer any questions that you have at any time. And if they don't know what the answer is, they will find the answer for you and come back to you or refer you to a person that can assist you.
They're asking if you have an 800 number. They're asking you if you have an 800 number.
Unfortunately, we don't have an 800 number.
I think we should do that. There's that other microphone, sorry.
Stand to the front of the stage. You got a speaker right on top of you.
Is that what it is?
You got the speaker right there.
has everybody caught what the website address is? I mean, it's been mentioned a couple of times this afternoon. It's www.keepmydoctornv.com. On that website, you'll be able to find a lot of information. A lot that has been discussed this evening. But if you go onto the website, you'll be able to see it, and it will also give you the helpline number again. So please feel free to contact the helpline, and they'll be able to answer any questions that you have.
Is doctor spelled out or DR?
It's spelled out. KeepMyDoctorNV.com.
So we have 3 more people. Any comments?
Yeah, Julie Erickson. My question is, when I went to, I'm Dr. Smith's patient. When I went in there, they said, healthcare partners were great, but I'm not seeing where they're great at all. And I'm the minority in here. I'm very young. I'm not with the elderly right now. But it's not fair that healthcare partner steps in and does this to everybody. They put us on the back of the bus. And so they're not stepping up at the office, I should say. We're at the bottom of the barrel here. The doctors are great. That's not where my concern is. I guess I'm probably in the wrong meeting.
No, you're in the right meeting.
My problem is at the bottom, at the receptionist, they're not being trained with whatever company this is. They're turning us to whoever, and it's not fair, because I, as a patient, I go in there for a referral. I don't know nothing. Oh, your referral was right here. What was they don't file, nothing's filed. And then I go to my doctor, and she's upset because she can't do nothing with these people out in the front, and nobody knows nothing. And the doctor's like, you know, so I'm ready to pull my records out there, and I will go to Vegas. And it's not fair that I have to go to Vegas because of the bottom of the barrel over there. The healthcare partners is not training from the beginning, and the doctors are getting hitting the head. From my point of view.
And we're glad that you expressed that, and we've got 2 positions here, Dr. Baden.
And I can't get a phone number. They wouldn't give me a phone number to anybody to talk to about it, and Dr. Smith's side just go out front. So I get supervisors' phone numbers, and I make the call, and it goes out the back door. What I just said went out the back door. So and that's me. I can't imagine being an elderly and going in there and being treated like they treated me. And it's not fair.
Firstly, let me apologize to you.
Whoops. We can hear you.
Okay, I don't know that you had that experience, but keep in mind that you're at the newer facility that Healthcare Partners has taken over. We've been in a joint venture with Healthcare Partners now in almost about a year's time, a couple of months short, and our referrals as Advanced Medical Center used to take about a month long. Now we're down to 72 hours, and they've done a fantastic job of getting this up to par. I believe, I can't promise you anything, but I do believe that if you give the new facility that was taken over by Healthcare Partners a few more months, they'll be caught up, and they'll be able to address your needs more properly and more timely. But again, anytime you have a takeover or a joint venture or ideas being changed and new ideas being brought in, there's a time of confusion. And I think this is what's happening with you. And I don't want to speak on Dr. Tenori's office, but just through experience of what has happened to us, that's what I would like to offer to you.
Next comment or
Okay,
question?
question and comment. To the young lady up there who said that you have the 2 people on staff, that's not enough. And the 702 number for many of us, it's too expensive to be holding online, waiting for those 2 people to answer all of these people and paying that bill. Okay, that's one comment. The other question is, was Senior Dimensions invited to this? If so, what was their comment for the reason for not coming?
Senior Dimensions was not invited to this meeting. This meeting was for us to hear from the Healthcare Partners patients.
Yeah, but wouldn't it have been helpful for them to be here so they hear what we have to say and what we care about? So they should have been, it should have been fair for everyone to be here so they could answer any questions that we had to ask them.
And again, they're not excluded, but this is Healthcare Partners looking to hear about, first of all, to clarify that you have choices and we want to hear about you. So, Senior Dimensions not being here, we don't know.
They're not hearing you.
We don't know.
They're not hearing you.
Your mic went out. Just come over here.
You have to get away from the speaker.
Thank you. Oops, I'm sorry. So the answer was Senior Dimensions invited. They were not uninvited. We just didn't talk to them about it. This is a Healthcare Partners meeting to interface with Healthcare Partners patients.
We'll have another one with
We will.
Okay. We'll ask it.
Yeah, because many people would like them here so they could hear what we're saying.
Okay.
And it's not us just calling them. They look us in the face and give us their excuses.
That is noted. Okay. Another comment or question?
I just wanted to ask or find out for certain, I think it was Dr. Tenori that said, because Senior Dimensions cut ties with youth. Okay. What did I understand you to say because it was too costly to them, or what? I want to get that straight. Why?
We don't know why. Okay, the reason they give is no reason. They said no cause termination. They have the right in their contract to give 90 days notice and say we would like to terminate it, not because of specific reason, just because we choose to. They had a choice apparently. They had the choice to terminate us, had the choice to force our patients to go somewhere else. But they're not giving us the choice to keep you or vice versa.
Okay. The other question I have is that is Senior Dimensions and Humana, they are Medicare pays their well, they take the $96 a month month out of our Social Security. Is it because they're HMOs, or how does that work, that we can't have private insurance supplement and have that, so we're not paying that extra?
Senior Dimension and Humana are like competitors.
Like what?
Competitors.
Yeah.
Okay, so they take senior plans, and they both take, our seniors and take Medicare assignments to them, and then they provide a package, okay, and you have those benefits, from co-pays to, the list goes down there. Each one have their own flavors, and we're not here speaking against one or the other. Apparently, I personally took them for 13 years, and I took Humana also for maybe, before it was Secure Horizon, but now it's Humana, so give and take about maybe 6 years. And we love that choice, because we love to have our patients have the choice of, if you like Humana, try it, and if you want to try Senior Dimension or the other way around, it is fine. We wanted that competition, and we wanted to have more than one choice here. So they're about the same, but you can sit down with each representative, and each one will tell you what they think of themselves. That's not what we're here tonight for. Okay, we're here that we want to hear from you, and we're telling you that we did not give up on you. We want to treat you if you want to stay with us. And don't panic and jump.
Right.
Okay?
Right.
Thank you.
Yes, I understand that, and I hope that it has been made clear to these people that it was not Dr. Tenori, Dr. Betty, or anyone of that Senior Dimensions dropped these two companies. They did not drop Senior Dimensions.
Okay, 4 more comments, and I believe we're coming to the end of our evening.
Is this on?
Yes, it is.
My name is Addie Hale, and I have a concern in that my understanding is Senior Dimensions will not be covering me after September 1st, is it? 30th. Okay, well, they're not going to cover it. So they're going away. I'm a recovering lung cancer patient. I had my surgery a year ago. I had radiation and chemo. So, and I'm going to be treated for basal cell cancer in my eye. Now, once I no longer have Senior Dimensions, would Humana or one of the other Medicare supplement providers not cover me because I have pre-existing conditions? That is my concern.
Only if it's renal. I called and asked that question.
Can't hear you.
If it's kidney, they will not.
We'll repeat the answer. Turn on your mic, please.
I think they will cover it, okay, because I think this is a condition from Medicare, because if the base stem from Medicare, if it's a senior plan, and if a patient is switching from one insurance to another, my understanding is they have to cover. There's no, the pre-existing conditions should not be held against you. Now, for your conditions, I'm not going to get into specifics. A lung condition, COPD or emphysema, allows you to change, you know, right now, if you wish to the competitor, and you could see whether your condition will be covered or not.
I don't have COPD.
Okay, okay, that's fair.
Yeah. Okay, thank you.
You're welcome.
Thank you. So we still have people coming up, okay. Yes, sir, state your name.
My name is Marion Blake, and Dr. Flowers is my first doctor, Dr. Batty. I've been with them for like 13 years, ever since we moved out here.
We're wrapping up. Let's keep the voices down. Thank you.
Okay, thank you very much.
Not you though. Okay. Thank you so much. Do you have a comment?
Yeah, for our senior, he's turning his back. I'm gonna guess, and this is my expectation, that there are a lot of changes in town, and I think the specialists will be changing as well, based on the need. I think healthcare partner will be listening to comment, like for our senior right here, and they will take in consideration whether to add the specific cardiologist, because it's not only him, there would be other patients with similar conditions.
Ma'am? Yes, Dr. Gowdy would like to make a comment.
Hey, Marion. I understand that the Healthcare Partners is talking to the group of cardiologists that you're talking about. And as Dr. Tenori said, there are a lot of changes and contracting that's going on with all this political stuff that's happening. It's an ever-changing community in medicine. Again, what's important is for the patients to be aware and understand that they don't have to give up anything yet. Things might change. These guys might come up with a contract that is going to resolve all of these problems. But there will be more specialists for Healthcare Partners, and hopefully some of your doctors will be listed on that. In response to the young lady with the lung cancer, I would recommend before you make any switches, you call the carrier that you're considering changing to find out if they do cover all of the needs that you might have as far as chemotherapy, or if there's any restrictions that they might have in switching over before you do actually make the switch.
And next.
I had one comment. I'd like to expand a little bit on the referrals that Healthcare Partners made. I was in for a referral to a skin doctor, and I had my referral before I left the office that day. So they were very helpful, and it was unlike waiting 2 to 3 weeks, and so I just like to say that they were very helpful, and I couldn't appreciate it more.
Okay, looks like we have 3 more people.
Yeah, I've been going to specialty med for 23 years, and I have Dr. Smith right now. And that would be like taking my heart out for me not to be able to continue to go there. I called Senior Dimensions as soon as I heard this might be happening. And they just told me that if I went, I don't know if they call it out of service, out of program, or whatever. If I went out of program or out of network, yeah, thank you. Out of network, I could keep my doctor. So at this point, it seems like the only way I can keep her, unless they come up with an agreement with everybody in that office, that's what I'll probably have to do, because I think it's a certain amount a year you can go out of network and still be okay, but that's pretty important.
First, I will pass the good words to Dr. Smith. She was earlier here, but she has a bunch of kids. Okay, so she had to leave. Now, the thing is not done yet. So from now until, first you have until the 30th, and you probably have until January 31st. We will come back to you, whether in such forum or through TV or media or other ways. We'll contact you about that. And then we'll tell you what the options as they go. For now, don't panic, just stay tuned, okay? Don't let anybody rush you into making a decision right away when you don't have to.
And I also told Senior Dimensions that I thought it would be nice if they would come up here and explain these things to us.
By the way, things just changed. I told you things are fluid and changing. Dr. Smith just walked into the room. Okay. Dr. Smith, can you please stand up? Okay. Now, she said that her heart was taken away, that she can't see you anymore. So it's between her, your husband, and yourself.
2 more people, and for all of you that are leaving now, thank you for your attention.
I just have a question. If at the end of September, they haven't made a change, instead of me going to another doctor and having all my records changed and everything, can I just cancel Senior Dimensions? No. I can't.
I'm Bob Sullivan, and I just have 2 quick things. Number 1, I'm hearing an awful lot of good rhetoric here, but it doesn't seem to address the pocketbook. All these nifty plans that we're going to have, what's the price differential between them? I mean, let's set the doctor part aside. What's the cost? I want to see the bottom line of this sort of thing. The second thing that really disturbs me is this meeting seems all backwards to me. There wasn't an agenda. The people that are supposed to be in charge of this thing aren't even here, like they're scared to see us or something. That's my only comment.
First,
it's that mic. It's off. Okay.
I think the battery died on. I think there is no cost issue if switching from one insurance to another. I was just told that it should be a neutral. So whether you're switching from one company to another, my understanding, or as I was told, there should be no difference in what you're out of pocket. However, you could ask all the questions like this to the salespeople from both companies, and you make the decision. My understanding, there should be no difference.
Here, what did you say, 400 people?
Yes.
About 400 people showed up here about the letters and information that they had gotten from the insurance companies, the healthcare partners, Sierra Health and Life and Senior Dimensions, that they have stopped their contract with their local physicians here, and they're diverting their patients to other providers. And I think there's a question and answer session to respond to questions that the patients, mostly the seniors, have had about these changes.
What do you think that people carried away with them today? It seems like there's a lot of confusion on what they could do and what they can't do. Can you clarify what exactly this means by the open enrollment, and being able to change or not being able to change by October 15th? I mean, a lot of them feel like they're being pushed out today, but do they really have to leave? And can you explain that process?
The open enrollment period is only for senior members that have Medicare, which they have given up their Medicare into another third-party administrator, in this case Senior Dimensions or Humana or Secure Horizons. There's only a special time period that they could move in and out of these insurance companies. This enrollment period starts on October 15th and goes up to the beginning of the year. And as the beginning of the year, they will be enrolled in a new program. The beneficiaries have been called and asked to make a change in their provider, and their deadline is September 30th, which is 15 days prior to the open enrollment period. That's why there's so much confusion. This is a real confusing issue for our seniors, and these are the people who are the actual beneficiaries of these things. So I think this meeting here today was to shed light in the questions that they might have, and most importantly, their options. And why we're here today is to tell them that if they're not happy with the change that their insurance company has requested them to have, they have options to do other things. They have an option to go to another insurance carrier. They have an option to change doctors. They have an option to go to straight Medicare. And we were just here to answer these questions for them.
There's going to be more questions for people watching at home. Where do they go to get the answers they need during this time period?
I think the best bet for these patients is to call Medicare. Medicare has direct guidelines of what they can, what they cannot do. I don't think Medicare is biased on which insurance companies they take or they don't take, and I think they'll get the most definite answers from them. I also urge the seniors to look at their policies and what they have with their different carriers. If they are with Senior Dimensions now and they want to change to Secure Horizon or Humana, they should call them first, make sure that their needs are met. If they're going to stay with Senior Dimensions, they should make sure that they have their needs met that way. If they have Humana now and they want to change to Senior Dimensions, they should call Senior Dimensions and find out what their options are.
I got a quick question for you. Humana has tried to get into the marketplace out here, and I did some information research on them, and they basically said that a lot of the patients are not allowed to change to Humana because of the lockdown that Secure Dimension has on this area, and the doctors basically would be scrutinized if they were to accept that insurance. Do you know much about that?
I don't think that's the case anymore. I think Healthcare Partners had a contract with both Senior Dimensions and Humana, and most of the doctors here were able to take both. Now, since the change has come about, and this is why this meeting is happening, the choices are limited to only a few providers in Pahrump.
How do you feel about being a part of Healthcare Partners these days?
I think it's difficult to give up autonomy. It was a joint venture for them to do the business portion of this and for me to practice medicine. And as far as that goes, it's worked well. I have more time to spend with my patients, and I have more time to sleep. And I think the patients are going to benefit from the presence of Healthcare Partners in Pahrump. It's a big company. We invited $3-4 billion company to come to Pahrump, and they've increased the pay rates of the employees, and all the employees have benefits, and it's just been a great thing for the community.
Thank you, Dr. Batty. You're welcome. Appreciate it. All right, let's start over. Dr. Nouri, why were these people out here, and what's the benefit of them coming?
Well, it's going to affect each one of them, okay, because they have a health insurance, which it's now making decision to separate our patient from us as a providers, and they're concerned about whether the next doctor will know them as much as we do, and that's why they're here.
How will it affect most of the individuals themselves? What will take place? What will they see in regards to they received a letter, and now a lot of them seem to be panicked So why are they panicked and why do they not need to be?
Well, normally, you know, the patients hears about certain doctor and they have experience with them and they choose to have a relationship with that doctor. Now, and I have a patient for 13 years since I've been in this town. I know them as I walk into the room. I don't even have to look in their charts, what do they have. And you know them and you know their family. So you develop a bond, okay, with your patient. It's more than just, you know, shaking hands and so on. And then you come with no reason. We were not given a reason. Our members were not given a reason as to why. Okay? And then they're forcing them to go somewhere else, and we're forcing us not to take them. Add to this one, these patients were our patients before even they sign on Senior Dimensions or on HPN. Many of them, when they make that decision to choose about an insurance, they ask the questions whether if I chose this insurance, can I keep my doctor? And overwhelmingly, the majority of the patients I asked say, yeah, they said, I can keep you as a doctor, that's why I took the plan. But now they're telling them you can't, and you have to go somewhere else. And it's creating anxiety because this town is still questionable whether we're underserved or not, but I can't guarantee you we don't have an abundance of doctors. So we can take more. And now you're forcing a good chunk of the population, elderlies usually, they need the most of the care because they're the one who have, unfortunately, multiple medical problems. And they need more time and they need more, you know, office visits. And then you're forcing all of them to be sequestrated into a smaller group. They're upset. They're not, I mean, collectively, they understand it, okay, individually and collectively, that they're squeezed into one corner and their options are kind of limited. And again, for no reason. That's what bothering us, bothering them. I mean, give us one reason as to why.
I couldn't tell you. But
so it's up to you guys. You can ask the questions. We ask the questions as to why it's been told it's a business decision. Not personally I asked the question, but through the healthcare partners as why this happened. I said it's a business decision. And business, why the timing? Why the timing is during when you can't change. Like if the senior, you have a senior worried about their heart, worried about blood pressure, worried about their lungs, about their backs, pains, and so on. And now they have to worry about whether they can see another doctor, whether they can start over and so on, creating all this one. And then at the same time, it's no cause, like no reason for it. I mean, no reason. I mean, give us a reason.
One person mentioned, what are we doing here?
I didn't do it. Okay.
That was weird. All right, one individual actually mentioned the mere fact that they felt that it was because of another provider coming into town, and they were trying to drive the customers to that provider. Does that make sense?
No.
Okay.
First, if one provider will solve the problem, then why they had 10, 12 doctors taking care of the patients? So unless they brought a Superman to town, okay, it's not humanly possible. Okay, there is not enough manpower to take care of the seniors. You know, especially, again, the ratio is easily 2 to 1, maybe 3 to 1, meaning they were, for the terminated doctors in this town or providers, they're probably 3 times more than the doctors that can see the patients. And again, those doctors who could see these patients already had their hands full. It isn't they were not in this town and they suddenly showed up and they have an open schedule, 0 patient, and then they can take them. No, it isn't the case. So they're busy, we're busy, but then now you take thousands of patients and try to shoot them to doctors who are limited in number, in options, and have to see their current patients and what comes on. Figure that one out.
The guy's supposed to call me tomorrow, so I'll find out. I left him a message.
Oh, okay.
So.